Imagine experiencing a sudden fever, a pounding headache, and a mysterious rash spreading across your body, all after a simple walk through the woods or a moment outdoors. What if these symptoms weren't just the flu, but the sign of a hidden, potentially dangerous infection? Today, we're uncovering the truth behind a group of diseases that often go unnoticed until they become severe. Rickettsial infections. Rickettsial infections represent a fascinating and challenging category of diseases in the world of infectious medicine, caused by a unique group of bacteria that can only survive and multiply inside the cells of their host. Rickettsial infections are transmitted to humans mainly through the bites of ticks, mites, fleas, or lice. These seemingly small creatures act as vectors, silently passing on bacteria from infected animals like rodents, cats, or even livestock, directly into the human bloodstream. Let's break down everything you need to know about rickettsial infections, from their alarming symptoms to the best methods of prevention. Symptoms: the warning signs you shouldn't ignore. The first signs of a rickettsial infection usually appear a few days to 2 weeks after exposure. The onset is often abrupt. Patients might remember feeling perfectly healthy one day and extremely unwell the next. The most common symptoms include high fever, severe headache, and a general sense of illness that can be difficult to describe but impossible to ignore. Depending on the specific type of rickettsial infection, additional symptoms can appear. For example, Rocky Mountain spotted fever, one of the most well-known rickettsial diseases, often presents with a characteristic spotted rash that begins on the wrists and ankles before spreading to the trunk. In scrub typhus, another form found largely in the Asia-Pacific region, patients may develop a black scab, called an eschar, at the site of the MediByte, accompanied by swollen lymph nodes, chills, and muscle pain. Other forms, such as epidemic typhus or murine typhus, bring their own distinct features, but all share the hallmarks of sudden fever, intense headache, and a rash appearing several days after the onset of illness. The rash can be variable, sometimes flat, sometimes raised, sometimes covering much of the body, and sometimes entirely absent. People may also experience nausea, abdominal pain, confusion, or even respiratory difficulties. Left untreated, rickettsial infections can rapidly become severe or even life-threatening. The bacteria often target the cells lining small blood vessels, leading to inflammation, bleeding, and organ damage. In some cases, particularly among older adults, the mortality rate can be significant. That's why early recognition of these warning signs and prompt medical attention are absolutely vital. Diagnosis: how doctors detect the hidden enemy. Diagnosing a rickettsial infection can be tricky because the early symptoms mimic those of many other diseases, such as influenza or other viral infections. Therefore, doctors rely heavily on a detailed medical history, including recent travel, outdoor activities, or exposure to vectors like ticks and fleas. Physical examination may reveal telltale clues: a specific type of rash, the presence of an eschar, or swollen lymph nodes. In addition, doctors may order blood tests to look for changes in white blood cell counts, liver function, or markers of inflammation. However, the definitive diagnosis usually requires special laboratory tests to detect rickettsia DNA or antibodies in the blood, or sometimes to identify the bacteria in samples taken from the rash. Because laboratory confirmation can take time, and the consequences of delayed treatment can be severe, doctors often begin treatment based on clinical suspicion alone, especially if the patient's symptoms and history fit the pattern of rickettsial disease. Treatment: responding quickly saves lives. The cornerstone of treatment for rickettsial infections is antibiotics, and timing is critical. The preferred medication is doxycycline, which is effective against most types of rickettsial bacteria, regardless of the patient's age. In fact, even in children and pregnant women, where doxycycline is usually avoided for other infections, the benefits of early treatment outweigh the potential risks. Antibiotics are usually started as soon as a rickettsial infection is suspected, even before laboratory confirmation. Most patients experience significant improvement within 48 hours of starting treatment, but it's important to complete the full course of antibiotics as prescribed to ensure complete eradication of the bacteria. Supportive care is also important. Patients may need fluids, pain relief, and close monitoring for complications such as low blood pressure, kidney failure, or neurological symptoms in severe cases. With prompt and proper treatment, full recovery is the rule, but delayed therapy increases the risk of serious outcomes. Prevention. Protect yourself from rickettsial infections. The best defense against rickettsial infections is to avoid exposure to the vectors that transmit them. Here are some practical steps to reduce your risk, especially if you live in or travel to regions where these diseases are common. When spending time outdoors, especially in grassy, wooded, or rural areas, wear long sleeves, long pants, and closed shoes. Tuck pants into socks to prevent ticks and mites from reaching your skin. Use insect repellents containing DEET or permethrin on clothing and exposed skin. Avoid sitting or lying directly on the ground or in areas with thick vegetation. After outdoor activities, carefully check your body and clothing for ticks and promptly remove any you find using fine-tipped tweezers. Keep your home and surroundings clean to reduce rodent populations that can harbor fleas and mites. For pet owners, use veterinarian-approved flea and tick controls on cats and dogs. Be aware of local outbreaks and follow public health recommendations. For certain high-risk occupations, such as farming or forestry, additional preventive measures and education can be crucial. Stay alert, stay protected. Rickettsial infections may be rare in some countries, but they remain a significant threat in many parts of the world. Recognizing the signs, seeking early treatment, and taking steps to prevent bites from ticks, fleas, mites, and lice can make all the difference. If you found this information helpful, please like and share this video to help others stay informed and protected. Don't forget to subscribe to our channel and turn on the notification bell so you never miss more essential health updates and fascinating medical topics from MediByte. Stay healthy, stay safe, and see you in the next video.